I'm so excited because acupuncture rocks it. I'm about to teach this class and I hope you show me you like it. Show me you like it. Woo! Are you excited? Oh yeah, we're about to start it. You're a TCM rockstar, there's no doubt about it. Are you excited? Yeah. I'm ready to rumble. Go Tamina. So welcome everybody. I'm so glad you are here for this first live YouTube. Yikes! I'm super excited, but I'm a little nervous. Just for the technology part of it. I hope it works. Yay! Thank you. I'm so happy you like it. I'm really happy you were here. I'm just excited. This is something I wanted to try for a long time, but I was a little nervous about it because, you know, it's live. There's no going backwards and I can't repeat it. So thank you. Oh my God, Taz! Thank you, Taz. I'm so happy you're here. This is a colleague of mine who joined. Thank you. I get lots of support. And where are you guys from? I see Ireland, I see Holland, I see Saudi Arabia. This is awesome. Philippines. Woo! You guys are coming from all over the world. So I can't believe you're here because I know time is precious. Everybody has a lot to do in life, but I wanted to connect with you, and I think this is what we need right now because of all 2020 craziness. If you're watching the replay, you're going to enjoy this as well, so stick with us. But right now, I'm so happy you guys are coming from all over the world. I also wanted to give a shout out to Mr. Leon Chu's class in the UK, who is watching, the whole class is watching today. So thank you. I'm honored I'm part of your class as well. Look at this, people from all over the world. So that's awesome. UK, Cambridge, here we go. Philippines and India. We get people in India, which is, I know in India right now, it's the middle of the night. So thank you for being here. I know that's not easy. It is raining in Vancouver. It's not a great day. But unless you never watch anything from my channel, I'm Clara and I'm from AcuPro Academy. And AcuPro Academy is really an online platform I created to have TCM resources for acupuncture students and acupuncture professionals. So that's really what I want to offer. I really want to help and make Chinese medicine, which is a complicated, deep medicine, into an easy way to grasp. So this whole class today is all about easy. Myanmar, whoa, baby, that is a ways as well. Look at this, it's awesome. You guys are from everywhere. I love it. I could see UK as well, obviously. Ireland is here representing. We got a few people from Canada, hopefully. And I'm so glad. So, we are going to start. I'm not going to delay it. We're going to start because our time is precious. And today what we're going to do is we're going to talk about acute pain. So the difference between acute pain and chronic pain is huge in TCM. I think when we talk about chronic pain, we have to do a TCM diagnosis that's very in-depth, and we want to figure out the root cause, the diagnosis itself, and we want to treat the root. It's not what we're going to talk about today. We're going to talk about acute pain. So when it comes to acute, we treat more the symptoms itself because we want to relieve the pain that is happening right now. It doesn't mean that if it's recurring, this acute pain like headaches, we don't look for the root. So eventually we want to look for the root cause, right? So, oh my God, Slovenia. Hello, people in Ljubljana and Poland. Look at this. Canada, Ontario. Yeah, baby. So we get people from all over the world. I love it. This is awesome, you guys. Thank you for coming. Thank you. So we're going to talk about acute pain. And this is all technology for me. So hopefully I get it to work today because it's just, and nothing crashes. And so what I wanted to mention is that when we talk about acute pain, we are going to treat the symptoms. But like I was saying, you want to make sure you also treat the root cause of the problem if it is something that's recurring. So there's a difference between recurring headaches versus an acute injury like you sprained your ankle, right? So we're going to talk about all this. So general pain, general acute pain, then trauma injury, then we'll talk about headaches. I couldn't take everything, but I wanted to take 3 little subjects because we can't be here for like 5 hours. We could, but you have a life and so do I. So I wanted to just take a snippet of talking about how we treat acute pain effectively. There is lots of options, and we have a lot of tools in our TCM toolbox, right? If you are familiar with, hi Ellen, oh hi, from Ireland, hi Ellen. If we have in our toolbox, you're probably familiar with Dr. Richard Tan or Master Tong's method of treating pain, right? And this is not something I'm going to talk about at all. I'm going to stay very TCM, classic TCM, in an easy, like I always do, made easy, grasp way of doing acute pain. That's great. Awesome. Yes, anytime. Just for Christmas. I see, hope to buy your book soon. So I'm like, yep, Christmas presents coming. That's a good idea. Ask for it. Someone might buy it. You never know, Santa Claus might come. You never know. So let's start it up by looking at general pain. So I'm just going to start the presentation here. Okay. If you guys have questions, you're welcome to ask as we go. I'll try to stop and then kind of reel back. So I started with stomach 36. The reason I'm starting with stomach 36 is because if there is an acute pain, let's say a trauma injury, bone fracture, headache, anything, you want to use stomach 36 for the only reason is that it's a healing point. It is what I call the vitamin C of the acupuncture points, right? It's like you're boosting. It is the commander point of immune system. So it is boosting your body, and it is a really good point to maintain overall health. Right? So using stomach 36 is going to help boost the healing process. It's great to use after surgery. If you've had surgery, it's great to use if you've had trauma injury for healing purposes. So I think that as a basis, it's a point that we should put in any kind of pain or recurring pain, because if there is recurring pain, we still want to look for the root of the problem and step back, but we want to try to heal the body, and stomach 36 is such a base point to start with that. So I would start with that. Okay, so the next thing I would put is, unless you're pregnant or your patient is pregnant, is Li4. Of course, Li4 is the best point for pain. And the reason it's the best point for pain is because it is a point that moves blood, right? It is counterindicated during pregnancy for that reason. So it is one of the best points to move blood. When there is pain, specifically acute, localized pain, it is due to blood stagnation quite often at the time. Not always, but there is always some kind of blood stagnation. It could be blood stagnation with heat. It could be blood stagnation with excess cold, which congeal, becomes like an ice cube, and then stops circulation, right? It could be a lot of different other patterns and pathogen that can block blood. But when there is localized acute stabbing pain, that is always a blood stagnation. And so Li4 will move blood, which would be really good for any kind of pain, right? Because it will release the blood stagnation. Now, do you want to put liver 3 with it? Sure, because liver 3 moves Qi, and Qi moves blood, right? So opening the gate, doing the 4 gates, and doing liver 3 and Li4 is probably a good idea. Okay, so those are the basic points. If you start with those 2 points, we're having one healing point, like I talk about the vitamin C point, and then we have the point that's going to release the pain, right? The kind of like it's going to help to move the blood and try to release the pain. So that's basic stuff. Okay, so that's general basic for pain. Now let's start to talk first or next about local versus distal. Okay, so when there is pain, and this is why Dr. Richard Tan or Master Tong's methods of doing acupuncture works really well, because usually it's a mirror kind of method, and it's a microsystem, and that microsystem is used usually as a distal system, right? So, but in classic TCM, we want to do points or acupuncture points that are going to be in the local area. So if I have pain in my wrist, I want to do local point in the wrist to release the pain. I want to do stomach 36 to help the healing process, and I want to do Li4 to move blood in order to release the pain, right? But we also want to put distal points that are going to help really bring lots of circulation and allow the pain to get better in that area. So distal points like long 7. I love long 7 because it is, as a reminder, the commander point of the head and neck, right? So if there is any kind of pain up here in the neck, in the SCM, right, in your sternocleidomastoid, if there's pain anywhere in the head, obviously that would be more headache, painful headache, or any tension that's happening in the scalene in the back here, right? So any tension that's attached to the neck, so even traps because your trapezius are attached, right? So anything in the neck and head, you have to put long 7 as your distal point if there is pain in that area. Of course, Li4 is your point for moving blood, for any kind of pain, but Li4 is also the commander point of, tell me what is the commander point of, type it in, get involved. I want to see Li4 is the commander point of what? It's okay to get it wrong. I'm all good with that. Tell me. I'm waiting to see what is Li4 the commander point of? The face, right? Okay. So Li4 is the commander point of the face. So any pain in the face, like jaw, a lot of people have jaw tension, right? So of course you're going to do local point, but you have to put Li4 because it is going to release the pain in the face. So jaw pain, toothache, having sinus headaches or sinus pain, right? Sinuses pain that is coming up. So yes, definitely the face, right? So Li4 is really, really going to help if there's anything happening. If you have eye pain, if you have a pain behind the sinus, all this, yes, exactly, all the face. So we want to put Li4. When it comes to PC6, pericardium 6, we want to use it when there is chest pain. So any kind of chest pain or chest discomfort, PC6 will be really good. So chest pain doesn't mean necessarily just heart-related or physical heart-related pain. It could be that there is esophagus pain, right? Behind the sternum, your esophagus is painful. Maybe there's really, really bad heartburn. Maybe there is pain that feels like we can't breathe, right? It's pain that's affecting the lung. Maybe it's an anxiety attack, but it feels really painful, right? No matter what, PC6 is great to relax the chest. So it's a really good distal point when it comes to chest pain, and of course for physical chest pain as well, and for heart pain. So the distal points are going to work very well. Stomach 38, which is located on the lower leg, far away from the shoulder, is one of the best distal point when there is shoulder pain. So if you have shoulder pain like rotator cuff injury, frozen shoulders, of course you have to do local point. There's a lot you can do, right? You can do cupping, you can do Trina, there's a lot you can do, electrostimulation, but you want to do your distal point, and stomach 38 has to be there. Now, one of the questions my students ask often is that, do I do it on the same side of the pain, right? Or do I do it on the opposite side? I am a very big proponent of doing it on the opposite side because the opposite side should have stronger chi. It's not as affected, right? So I found that you could do on both sides. Of course, you could do bilaterally, but it depends if you have too many needles, if the person is weaker or very deficient. You don't want to overwhelm them with too many needles, right? If you have someone that has frozen shoulder and they're 75 and very weak, you're not going to put like 35 needles. That's way too stimulating, way too strong, right? So we want to keep it smaller. So the idea is to do points on the local area, and then you could do opposite for stomach 38, so opposite side. Plus, remember that in general, like the large intestine is the only meridian that crosses the body, right? At the face, it crosses the body. No other meridian crosses the body. So having said that, if you have a shoulder plane, which is more large intestine meridian per se, doing the opposite side will bring a lot more chi and blood to the area. on arthritis pain. So arthritis pain that's an acute pain at the time of when it's happening. So you want to treat the pain, but you have to look for the root of the problem, right? So the root of the problem when it comes to arthritis pain, I'll just put this up so everybody can see this. When it comes to arthritis, you have to do a TCM diagnosis. It depends what kind of arthritis. Is it rheumatoid arthritis? Is it osteoarthritis? We have to look at the root cause. A lot of time there is either deformation if there's phlegm. There could be dampness, right? If it's raining, the person's like, every time it rains, my pain is worse. If it's cold for some people, cold and damp, it makes it worse as well. So we have to address all those. So it's very specific to the TCM pattern, but you could still try to relieve the pain locally and do a distal point. So hopefully I answered that question for you in that perspective. Okay. Spleen 6. I think sometimes we forget that spleen 6 is a hip commander point. I love spleen 6, right? I love spleen 6, a great point. So I'll answer your question in a minute. Pain before going to the having a bowel movement, you have to figure out the cause for that. You have to look at the TCM diagnosis and figure out the cause. So that's very important because obviously there is issue there. So sorry about that, but I can't answer it right now because you would have to do a TCM diagnosis. That's super important. So let's go back to hip and spleen 6. I think we forget that spleen 6 is a point that, it's great. It's counterindicated during pregnancy, but the rest of the time it's a great point because it crosses 3 meridian, right? The kidney, the spleen, and the liver. It crosses those 3. So if there's liver issue, spleen issue, or kidney issue, yes, it's fantastic, right? So yeah, Taz is like, spleen 6 is one of my favorite ever. My favorite ever is stomach 40. That's my favorite point, but I would say spleen 6 is the second favorite. Okay, you guys, tell me which one is your favorite point. Put it down on the comment. What's your favorite point? You're welcome. Thank you for the Irish luck. I'll take it. I love stomach 40. Favorite point of all time. But Taz, I have to say spleen 6, very, very second. It's awesome. Favorite point. And I would say third favorite point for me is gallbladder 34. So, bonjour from Quebec. Here we go. We needed some French in there somehow, right? So spleen 6 is, it works really, really well, Hank. I totally agree with you. Li4, favorite point. Yeah, pretty good too, right? You guys like strong, good points. Spleen 6. We are strong, loving spleen 6 in the house. Kidney 6 too, I agree. Kidney 6 is awesome point. You guys have your favorite point. I love it. It's kind of like, So spleen 6 is really good for liver issue, kidney issue, and spleen issue, but it is also the commander point of the hip area. Ooh, liver 3. Yeah, that's a good one too, Franny. I love it. And then spleen 6 again, coming back. Awesome. So spleen 6 is really good when it comes to hip issues. And when I'm saying hip issues, I'm not saying just the hip girdle. Yeah, stomach 36, Hannah. You gotta love stomach 36. So if you look at the hip girdle, if you have anything in the hip flexors, so musculoskeletal issue, you have to put spleen 6. If it's in the front and the back or in the side, so meaning if you have sciatica, I would put spleen 6 because it is part of the hip girdle, the sciatica, right? If you have sacrum issue. So anything that's happening MSK or musculoskeletal wise, I would put spleen 6. But also internally, if you have pelvic inflammatory disease, very painful menstruation, I would also put spleen 6. It's not live on the other site. What other site? Oh, Melanie, what do you mean it's not live? Oh, that's weird. So Melanie says, Clara, we have been waiting. It's not live on the other site. So it should be if you go to AcuPro Academy. That's weird. And it should be live there. So let me check. That's the technology part of it. Let me check. So if you go on it, it says live stream. I'm looking on my phone, you guys. And you click below. If you click below, it is live. So it should be live. Let's see. You would think it is live. I don't know why it's not going live. Okay. It says live stream. And I see everybody's question. Okay, Melanie's like, we typed in YouTube and it's not there. I knew technology was going to. It's so weird. All good. It's just delayed and someone is being impatient. I don't know. Is it delayed? Because I can't see it at all. Like, I'm like you, I can't see it at all. So let's see if it's coming in or not. But I just want to make sure it is. That is so weird. Now, I knew that would happen. Okay. But, oh, it is delayed. But that's what I'm seeing, things that happened way back when. So this is so weird. I don't have a link. I don't have a new link. That is so bizarre. I don't know why it's not showing up. It is showing up now, but it is delayed. I agree. Try to refresh. Okay, so let's try to refresh. Good idea. The old link is not working. Rubina. Hi, Rubina. So just try. No, it's not live on there. I was there. Okay, so if I go to AcuPro Academy, sorry you guys, I wonder why. Because some people are in, obviously. The old link is not working. Look for the live. Okay, so if I go to the live, okay, and then I go there. Oh yeah, okay. So I'm going to show you how it is. Can you guys see this? Okay, do not press on this. Go below. Okay, so do not press on this. Go below and press on this one here. And then see, I come up. You see that? Yeah, so that should be it. I did refresh. It does not work there. Wow, that's so weird. Okay, so come out of your app, then come back, and then you should see this. See this? Okay, right? But then below here, if you press on this, see, now I'm in. It's okay now? Okay, we're getting it? Yes, we got it? Yes, hopefully. I knew that would happen. It's not easy, right? Yes, okay, perfect. So we got everybody. Well, that was going to happen. My first YouTube live, there was going to be some weird thing happening. So hopefully everybody is in. Okay, well, you can watch the first 20 minutes that you've missed so far when I put it up later on. I'll put it up later on. So, okay, everybody is in. Woohoo! Well, you guys missed a little bit, but not too much. Just a little bit of an introduction. Sorry about that. Oh, man, still got the front page on YouTube. That's so weird. If you push below, yes. We are in? No. Melanie, are you guys in from your YouTube page? Yeah, well done. Because, I mean, I don't know if you're on your phone or anything, but it is below the page, right? Hooray, you got it. Okay, Melanie, you're in. Nina's in. Okay, everybody is in. Yes. Okay, perfect. Okay, we are in. Well, woohoo! So now we are in. You guys missed my singing. I was singing earlier. You missed that. Next time we'll do better. Okay, so next time we'll figure it out better than this. I knew it is not easy. So we were talking about spleen 6 being the best distal point for the hip girdle. So we were talking about distal point. As you can see, all the distal points are here now. And we were talking about distal point for acute pain. So if there is pelvic floor issues or pelvic inflammatory issues or dysmenorrhea or any pain in the hip area, internally or musculoskeletal, I would put spleen 6. So we are all in. Thank you for coming from all over the world again. For people that are watching the replay, this was interesting. This is what happened when you're live. At least the internet's still working and it hasn't cut off yet. So distal point, obviously, bladder 40. Bladder 40 is one of the best point for lower back, right? So anything happening in the lower back, and I would say lumbar and sacrum at the same time. So lumbar and sacrum would be part of the lower back, and that you have to put bladder 40, right? Bladder 40 is the commander point of the lower back. It's a distal point that's going to help when there is lower back injury or pain. That's really acute at the stage of the acute part of the pain. And stomach 36, is a great point again, not just for healing, like we said at the beginning, but for stomach area, right? Because it's also a commander point of immune system and abdominal area. So if there is abdominal pain, you want to do stomach 36 for sure, because it is the commander point of anything that has to do with digestion, right? So if there's any digestive pain. Okay, everybody's here. Everybody got in. Let's breathe again. Oh my God, that's crazy. Okay, so let's take a look at, we talk about distal point, right? So I want to talk about pain itself. So the Xi-Cleft point. Love the Xi-Cleft point. So the Xi-Cleft point in general are going to treat most of the yin Xi-Cleft points are going to be more relating to blood issues, TCM blood issues, by the way. And then the yang Xi-Cleft points are going to be related more to pain, specifically acute pain issues. So when there is acute pain, you want to look for the right Xi-Cleft point and insert that one in there. Often it will be a distal point as well. So you want to do the local point, of course, but you also want to do distal point. So if you look at stomach 34, for example, you see stomach 34 is your stomach acute pain. So we said earlier you have to put stomach 36 for acute stomach pain, because anything happening in the digestive system, you have to put stomach 36. And then stomach 34, tutsun above the lateral superior angle of the patella, so on your thigh. So stomach 34 is going to be really good because it's the Xi-Cleft point of the stomach for any kind of acute stomach pain. And of course, you could also do stomach area, like when 12, stomach 21, to relieve the pain locally. Sometimes people don't want to be touched on the stomach because the pain is so bad. So do your distal point, right? LI4, stomach 36, stomach 34, right? All those are going to help a lot as well. Sore throat, if the sore throat is really, really bad, LI7, so large intestine 7, is really good when there is like strep throat, like the shard glass that goes in there. That's a really good point for that. Acute leg pain, specifically if people have like a lot of cramping, calf cramp, or what do you call? I wanted to say another word than cramp. See, this is what happened with French people. Spasm, that's it. Really painful spasm. You want to put a gallbladder 36. For acute ear pain, Sanjiao 7, very good point for acute ear pain as well. So again, you want to treat the root cause, etc. But in the meantime, LI4, right, for ear pain, and then your Sanjiao 7. Small intestine 6 is great when there is sudden arm pain, like maybe someone has carpal tunnel, or they have a tennis elbow or a golfer elbow. That helps a lot. For painful urination, bladder 63 is the point for any kind of acute urination pain, right? You're very welcome. I'm so glad you're enjoying it. That's great. I love this. I'm going to put this up because that made me feel good. Woo! Thank you. I'm so happy you're enjoying it. God bless you too in Ireland. So one of the points that I love to use is kidney 5 and spleen 8 when there is dysmenorrhea. So specifically when the dysmenorrhea is happening. With dysmenorrhea or painful menstruation, you want to look at the root cause always. But today is the day that the person is coming to see you and they have really bad cramp, right? They're really in pain. You want to do kidney 5 and spleen 8 to relieve the pain at this time right now. Then you want to figure out what's the reason for the dysmenorrhea, what's the TCM pattern, so you can address the root cause of the problem so you can get rid of it and help the person not have this eventually after the next cycle or the one after that, depending on how long they've had it, what the cause is, etc. So this is a really good combination, kidney 5, spleen 8 for dysmenorrhea. Good? Okay. Another one that I like to use a lot also is heart 6 with PC6. So, hey, 2 6s. Heart 6 and PC6 together, great for chest pain. So PC6 because it's the commander point of the chest, and heart 6 because it is the Xi-Cleft point of the heart. So Xi-Cleft points, as you can see, are so fantastic when it comes to having pain that is needed to be addressed. And again, do the local area and do the Xi-Cleft point with the distal area. That is going to be a very easy, fast treatment, and it works really, really well. Like I said earlier, for people that join us later, there is a lot you can do for pain, and electrostimulation can be part of your treatment, moxa, cupping, there's a lot. I'm only talking about acupuncture today to make it simple and easy. Good, so everybody's still with me? We're good with the acute pain and the Xi-Cleft point, right? So, okay, I'm going to take, before we talk about acute injury, I'm going to take a little break on the PowerPoint, and I'm going to look at you from a different point of view. Hello, my board. You like my board? I'm in school. I have my board. Hi. So I want to show you something that is also very interesting to me that I love about TCM. One of the theory I love the most in TCM is the 5-element theory. I love the 5-element theory. It makes so much sense to me, and it's just so beautiful laid out. So in the 5-element theory, the 5 elements, wood, water and fire and metal and earth. But what we look at today is injury and acute injury. So I would like to talk about this, my hand here, okay? So I am going to draw my hand or your hand or a beautiful hand. Here we go. Look how big my pinky is. It's a beautiful pinky, This is awesome. Do you like this? It's really pretty. Okay, so in general, when you look at fingers, if you injure or if you have pain in some fingers, like acute pain, right? It could be arthritis pain that comes in acutely. It could be, I had a patient yesterday that came and she said, I don't know what happened. I woke up and my thumb is so painful, and it was never painful before. So I don't know what's going on. I'm like, did you injure it? Did you fall? Did you, strain? Did you do something? She goes, no, I can't figure it out. But she was in a lot of pain in the thumb. So let me show you something about the 5-element. I'm going to change color. That'll be better. The thumb in the 5-element is related to the spleen. Oh yeah, the earth, right? The index is related to liver. The middle finger is related to the heart. The ring finger is related to the lung. And the baby finger is related to the kidney. That is what's going on there. So when you look at the 5 elements and you look at your little hand there and you look at having pain in certain area, then when my patient said, her thumb was really hurting, but she didn't injure it, but it was really painful today, yes, it could be an onset of arthritis. She's pretty young and it's not in her family, so I don't think so, but it could have been. The idea is to look at what's going on with the spleen, the TCM spleen, right? What is going on? So I want to ask her more questions regarding what's going on with her digestive system, her worry, her overthinking, all this. So, I'm not going to talk about needling technique today because that would be too much. I'm going to stick to my subject, okay? But maybe that's something that we could do next time. Good? Okay. So I want you guys to, so if people have cold pinkies, is that a kidney deficiency? If your pinky is always cold, is that a kidney yang deficiency? And that's something you want to investigate, right? That's the good part about TCM is when you see clues, like the cold pinky, when you see clues, you want to see what is going on with this person's kidney. Like, let's investigate, let's ask more questions, let's figure out what's going on. So what I want you guys to do, I want you guys to do me a favor right now, and I want you to look at my hand. See my hand here? Do you see that my index finger is much shorter than my ring finger? You see that? My index finger is much shorter than my ring finger. Okay, so now look at yours, and see if yours is much shorter or if this one's longer or if they're equal. Okay, so let me know if your index is shorter or your ring finger is shorter. Look at your own hand, okay, and see. This tells me that my liver has to be protected. My lung is very good because it's much longer, so I have more tendency to have liver issues. Yes, Will's like, yeah. So I have to watch my liver because I'm type A personality. Big surprise. Ha ha ha. So my TCM liver organ system itself equal. Equal is good to me now. That means that it's good. Index is shorter than ring finger. So rule, yours is definitely, you have to watch your liver. Okay, it is shorter. So if it is shorter, then you have to watch your liver. If you're long, the ring finger is shorter, then you have to watch your lung. So if you have people that have pain in any of those fingers, you want to investigate and look for it. Okay, you want to look for what's going on with the lung, or with the liver, or with the kidney, or with the spleen, or the heart for that matter. Another thing that you can watch too, that's me too liver, all the type A in the house, right? This is crazy. Another thing you can watch too is looking at your hand. See if your, sorry, I'm going to do this, if your middle finger is slightly crooked. So put it together and see if it's crooked. So if it goes sideways, that means you have probably more tendency to have heart disease. So make sure that, it doesn't go sideways. And you can see that in older people. If you look at older people's fingers and hands, most of the time the middle finger is bent like it goes in a little bit of an arc, right? In a little bit of an arc on itself. And that is heart disease. So it's what I love about TCM, and there are clues, right? So it's exactly it, right? There are clues that tells us what to look for. Okay, so that's my little sidebar on what to do when there is pain or any issue happening with the 5-element finger relationship to your fingers. So hopefully that was interesting, and you guys can look at your hand and see. So right hand slightly sideways. Okay, Rubina, so watch your heart. Okay, watch your cardiovascular system and make sure it's all good. Okay, so let's continue. Before we continue with this, I wanted to, I wanted to tell you that all the slides today in my presentation are from my AcuPoint Made Easy. If you've never seen it before, that's the book right here. And this is the PDF or digital version. If you want to know how to get it, the link is below, or you can go to my website. It's pretty simple. I have the link everywhere. So that's my plug. Okay, let's go back to the presentation and to acute injury. It's very interesting. I'm glad it's interesting, right? So index finger shaking automatically. I can't advise because I'm not your doctor, Rafi. So as I said, if index, then that's a liver issue, as in TCM liver. So you have to investigate a little bit more and see what is going on there, right? Slightly sideways. Okay, so Carmela, her middle finger is slightly sideways. So watch for cardiovascular, specifically if it's in your family, right? So yes, I love that you guys are watching your fingers and telling me what's going on. I love it. This is awesome. I feel like I'm connecting to you guys. So this is really, really cool. I love it. Good. Okay, let's talk about acute injuries. Okay, so we're going to talk about acute injuries right now. So I'm going to go back to my whiteboard. Hello again. Okay, so when it comes to acute injuries or trauma injury, we have, let's say, a sprained ankle, or you strain your wrist, right? Something happened, you went skiing, or you fell off a bike, or for some of us, you just don't look where you're going and you fell off on the sidewalk. That can happen too. We've all done that. So if there's an acute injury, as in the ligament, tendons, and joint injury, right? So if there's an issue like this, I would like to look at what it looks like from the perspective of symptoms. And then what does that mean in TCM perspective? So the first thing is there is pain that is local, and it's stabbing acute pain. Let's say it's a sprained ankle, right? So if I sprain my ankle, it is going to be stabbing acute pain. So stabbing acute pain in TCM is blood stasis, right? That is stabbing acute pain. It's like purple in the area, it's really bruised, you sprained your ankle, it is stabbing pain. So when there is stabbing acute pain, that usually most of the time turns purple pretty quick, that is blood stasis. The second thing is most of the time when you do an acute injury, there is swelling, right? It's going to swell in that area. So here we go. Swelling is usually dampness, right? That's the second thing that we're going to have is we're going to have dampness because it's going to swell. The third thing is there's massive inflammation, right? That's the body's response to the acute injury. So there's inflammation, which feels usually hot to the touch, right? So inflammation and hot to the touch is going to be excess heat, right? So this is excess heat in there. So Tamina's like, ching wow. So there is definitely those three that are coming up. Blood stasis for the pain, dampness for the swelling, and heat for the inflammation and the hot to the touch. Now, this is why in conventional medicine, they're going to say, let's put some ice on it to bring the inflammation down because of the heat, right? In TCM perspective, we usually don't like to put ice anywhere, right? Because it blocks circulation. So it's a very different approach. But at the same time, you do what you feel is best for you. I'm just telling you that's a TCM approach, right? Because we're talking TCM right now. So when you have, let's say, this ankle sprain or the strain of the wrist or whatever acute injury that happened, right? Maybe you rotator cuff injury, something happened with that injury. We want to first, in the acute stage, we want to address those three things, right? So the first thing we want to do is we want to move blood because there's blood circulation issue. So move blood, we want to do Li4, which we had said no matter what, we have to put that point because it is a point for pain. It relieves pain, right? So it has to be there. But I would also put liver 3 because liver 3 moves chi and chi moves blood. So to open the gate, get the flow going, right? Get all the flow going. So in general, you want to start with this, right? Then you want to remove the dampness. So usually one of the best points to remove the dampness will be spleen 9, right? We would put spleen 9 to decrease the swelling. And then we want to get rid of the excess heat, or we want to bring the heat down. So basic point to bring the heat down would be Li11. So you start with just that. You decrease the heat with Li11, you relieve the swelling with spleen 9, and you move blood with Li4 and liver 3. So that's the first thing you do, okay? Then, of course, if it's affecting the tendons, the ligament, the joints, which it could be if you have like rotator cuff injury, if you have sprain of your wrist or strain of your ankle, so you have to put that influential point of all the sinews, tendons, ligaments, joints, which is gallbladder 34. So now you have to put this. So if someone comes home and they have, or a patient just sprained their ankle, this is very simple. Everybody can get that done. Then you want to do local points, right? You have to do local points wherever the injury is, and distal point as well. So you want to do local point and distal point, right? So to help out. You want to do stomach 36 to help the healing process go faster, right? So we have the local, we have the distal, and we have stomach 36 for healing perspective. So if you do this, the closest to the injury time, the faster the recovery. The closest to the injury time, the faster the recovery. If you just have the patient that sprained their ankle today or yesterday, the healing is going to go so fast if you do acupuncture right away on it. If it's a week later, it might take a little bit longer depending on the person's basic pattern. If they're very weak, very deficient, their essence is low, or they're older, or they have really a weakness, as in they're very deficient, it might take a long time to heal, right? So it depends on a lot of factors. But in general, the closest to the injury, the faster to the heal. Cold feet are not a painful thing unless it's Raynaud's disease, right? So, and that is going to be cold feet usually, well, depends if it's cold hand and cold feet. That could be a liver qi stagnation, circulation issue, or it could be if it's just the feet, it could be a kidney yang deficiency. So we need to do a lot of moxine, that's other things, right? But let's go back to pain. So I'm just going to continue doing this. So that's for your acute injury, basic stuff, right? That's really easy. We don't have to do a lot. That makes it easy. Hopefully that makes sense. Again, do local point unless the person doesn't want you to touch them on the area because it's so painful. Do distal point, relieve the patterns, and then add up gallbladder 34 and stomach 36 to it. Easy? Good? Okay. So let's go back to the presentation on that one. Okay, so we were talking about sprain and acute injury, etc., right? Another thing that happened that obviously can happen is breaking bones, not just a sprain or a strain, but having a broken or a fracture. So when we break a bone in TCM, you want to be able to help the healing process. And the first week or 2 weeks of the injury is a bit different than the next 4 weeks of the injury, right? So I'm glad you're learning a lot. Yeah, that's awesome. I'm going to put that up because that made me feel good too. Really enjoying this, learning a lot. Thanks, Roll. I'm so happy you are. That's awesome. Thank you. So that's the whole point, right? I want to make sure we learn from this. So when you look at a bone fracture, you want to make sure that you are going to start the healing process. So again, let's say we broke, a wrist or the ulna or the radius and the ulna or the tibia and the fibula, like who knows what you broke, right? Or what the patient broke. So on the opposite side, you can do points in the area, right? So let's say you broke, radius and ulna, you can do point on the other side, right? Couple of points that are great that are local. But in general, your best bet is to address the problem. First, the problem is there's pain. So Li4 has to be there. Stomach 36, like we said, that's for healing purposes. So we want to make sure we do that too. Then, of course, when you broke a bone, you need to put the bone point, right? The influential point of the bone, which is bladder 11. We want to put the marrow point, gallbladder 39, right? So this is what we want to do. Then because when there is a bone fracture, blood is affected because we need, obviously bone marrow produce the blood, right? So we need to also address the blood, so bladder 17. And of course, joints, ligaments, and tendons in that area have been damaged as well, so gallbladder 34. And then, of course, muscles in that area are going to be affected. First with pain and inflammation, then with atrophy, right? There's going to be an atrophy that's going to happen 2 weeks later because we're not moving. Specifically, if you are a cast, you wear a cast, right? So spleen 21 is a great point to help all the muscular region in the body. I would probably also put spleen 6. And the reason I would add up spleen 6 is because spleen 6 is related to liver, kidney, and spleen. Spleen is related to muscle, liver is related to tendons, joints, ligament, and kidney is related to bones, right? In the 5 elements, so bone with kidney, liver with sinews, and spleen with muscles. So I would add up spleen 6 because you want to try the healing process to help with all those musculoskeletal affected area. Is that good? Good? Okay, what if you break both wrists? Man, that's not a good day. Melanie, try to refresh it if it's frozen. I'm not sure because mine is working well. If you break both wrists, what you want to do is you can't needle at first on the wrist area most of the time. I would do the ankles, okay? For sure, I would do the ankles. So do the opposite limb. If you can't do the limb itself, do the opposite side at the same area, right? If it's the wrist, do the ankle. After 2 years, which point can I then best use? After 2 years of breaking something. So that's the thing. If it's been 2 years, it's not an acute pain anymore. So that's another class altogether, right? So, hey, Calvin, how are you, Cal? Long time no see, my man. Good. I'm glad that you're here as well. So I recognize so many people. So hopefully that helps, right? This is basic. And again, this is all in my AcuPoint Made Easy book if you are interested and you don't have it yet, but I know a lot of you have already supported me and got either the PDF or the book or both for some of you, which is awesome. And I hope you're enjoying the heck out of it. Okay, let's continue. Because I know time is precious for everybody. Hi, Cal. So, let's talk about headaches, right? Acute headaches, for the treatment of acute headache. I'm just going to take this down from my board for you guys. We're almost there. This is good. Look at you. Look at us. Hello from the Philippines, Griselda. Okay, so when it comes to headache, what I would say is, oh, the book is, the link is below the video. If not, you can go to acuproacademy.com and you'll find it right there on the main page. You can click there and then you can either get the PDF or the book. Awesome. Yay! You can go to my Facebook page too. It's on my Facebook as well. So you did, Melanie. I know you did. Thank you for your support. It's dawn here in the Philippines. Yeah, I know you guys are 15 hours ahead of us. So it is really a big, big early morning for you guys. So let's look at acute headaches. So one of the points that I like to put when there is migraines or headache is long 7. And the reason is it is the commander point of the whole head and neck, right? So anything that's happening headache-wise, doesn't matter if it's occipital, if it's frontal, if it's temporal, vertex, the whole head, you want to do the long 7. Elaine says it's wine o'clock here in Ireland. I bet it is. Darn, it's not beer o'clock, it's wine o'clock. I get it. That's awesome. So you're funny. Just wondering for acute pain in the hips. Yeah, Paul. So we talked about this before, but maybe you were not there because it was earlier and things were not working quite well. It's technology today. Spleen 6 would absolutely have to be there because it's the commando point of the hip. So you definitely want to do spleen 6, right? Because that's a distal point. So that's what I would do. So for long 7, any kind of headaches, you want to put long 7. Obviously Li4 because it also relieves pain. So I'm talking about at the time of the headache, right? There is a difference between the root cause of the headache, which we have to have and to look for, so we prevent the headache or the migraine from coming. But if it's happening right now, right here in your office, then I would definitely put Li4 and long 7 unless the person is pregnant, and then I would not do Li4, right? So, oh, thank you, Whiskey Clark. Thank you, Agatha. I like that. Your book is really wonderful. I still have it. Yay! I'm so glad. I'm really happy you're enjoying it. That's awesome. Thank you for the love. So, in general, once you put long 7 in there and Li4, that's your distal point, right? But there's more distal point depending on the area affected, right? When it comes to headache. Again, this is just acute. We're not talking about the root cause, which I said earlier you have to do. So here's one of my favorite things to look at is the location of the headache. So if you have a headache that is going to be, I'm going to start temporal because it's one of the most common one, right? The one on the temple, if you have a temporal headache, you're welcome, Paul. You want to do your long 7, your Li4, and then you want to do local point, right? Local point like gallbladder 20, Taiyang, right? So those 2 points are going to be local that are going in the area. If you want something like gallbladder 8 or gallbladder 9 or Sanjiao point, anything in this area, you can do to help relieve the pain. And then you want to do your distal point. So yes, long 7 Li4, but your distal point would be gallbladder 43, one of the best points for headache on the temple region. Make sense? Okay, so if you have occipital headache or tension headache, which a lot of patients have, right? A lot of people go, oh my God, I have such a tension headache. You are wanting to put local point again. So gallbladder 20, of course, right? You could do bladder 10, which are all in the occipital region in the back here. So that's good as well. And the best point that is distal for occipital headache is bladder 60, right? Because the bladder meridian goes in the back. So bladder 60 is really good when it comes to occipital headache. And it's further away from it, so brings the energy down. And again, your long 7 Li4, right? Stomach 36 to help the process faster. I'm repeating it, but because I wanted to make sure we grasp the whole thing and fast and easy. If you have patients that have headaches that are frontal or orbital behind the eyes, or frontal, that's more of a stomach headache, right? So it could be due to dehydration, etc. But today they're coming and it's like, oh, I have a bad headache here or behind the eyes, it really hurts. You want to do stomach 8 because stomach 8 is your local point, and do 23. So all local point. You could do yin tong as well. It'll help as well. Gallbladder 14. Anything that's on the area. Plus, you want to do stomach 44 because it is a stomach meridian issue. So you want to do stomach 44 as your distal far, far, far away point. Good. The last but not least is the vertex headache. So this is not as common. Vertex headaches are not as common in general, but some people do experience the top of the head, that's really painful. So of course, do 20 is right there. So you could do anything that is local, like bladder 7, all around. Do 20, like Song, which is a extra point or 4 extra point around do 20, and then liver 2. You want to bring the vertex headache because that's a Julian headache, which means it's a liver headache. You want to bring it down and bring it all the way down. So liver 2 is far away. Sometimes you can use kidney 1 if it is really more of a kidney issue, but generally it is going to be more a liver issue. So liver 2 would be your best bet. So this is what we look at when we look at distal versus local headache that is acute, right? So oh man, I love this, Alex. Thank you. I actually bought both PDF and the book. It's awesome. Thank you very much, Alex, for your support and for the kind word. I'm so happy. Can I have tips for hernia? So hernia pain, again, that's you want to do local point and you want to do distal point. Hernia pain, usually gallbladder 34 as a distal point has to be there. So is spleen 6 because hernia is part of the hip girdle. So that's your distal point, and then you want local point as well. So this is a whole array of generalization. But at the same time, you want to figure out what's going on, right? You want to treat the root cause of the problem. We're just talking about acute pain. What about the pressure feeling in the head, not a headache? So if it feels pressure like a tight band, like if it's a tight band around the head, is that what you're asking, Alex? Like where it's like squeezing or very big pressure, that is usually phlegm. So phlegm, best point for phlegm, my favorite point of all time, stomach 4T, right? Stomach 40 is my favorite point of all time. Very good for phlegm, best point for phlegm. So that would be a good point to put if there was that squeezing, painful tension. The best place to buy my book should be below the video or on this website here, AcuProAcademy.com. So if you go to AcuProAcademy.com, go on the first page, scroll down, you'll see it, and you can click on it, and then you can buy it. There you go. That's good. Okay, awesome. So I hope that made sense, and you guys figure out all this. Yeah, stomach 40, best point for phlegm. Here it is here. So if you go to my website, AcuPro Academy, there's tons of resources. This can help you a lot. And those are some of the resources that are offered. A lot of free stuff, right? Like a lot of stuff that is free. I have free courses, TCM Diagnosis and Foundation for the students out there that need some help in reviewing the material in a quick, easy way. I have protocol and case studies, lots of stuff on meridian and acupuncture points as well. If you go on my resources, you can also see the book if you are interested in the book. I also am on Instagram and you can connect there. I'm on Facebook every day on those platforms, and I want to make sure you're very welcome, Nina. You love it. Melanie loves it too. Yeah, that's awesome. That's awesome, awesome. Yeah, so happy you guys like the book or the PDF or whichever version you guys got or both. I wanted to thank you all. I wanted to do this for 40 minutes and it's been an hour. So I'm so glad you came in today. I hope you really enjoyed. This is the first time I'm doing this. If it is really something you like, let me know because I want to keep doing more live to connect because I feel like it's easier to connect and I like to connect with you guys. So I want to do more of those. So I want your thumbs up that you want to do more live event, and then we can have more. Thank you, thank you, thank you. Take your book everywhere with me. Okay, Elaine, that's awesome. I love it to soak up all the info. I love that. Thanks, Charlie. Hi, Charlie. Charlie. So those are people that I know that were students of mine way back when. Charlie Rose. I'm so glad you guys came in, and I thank you all for showing up and taking the time to come in. Hope you got lots out of this. Mwah, mwah, mwah. Keep rocking it. using TCM and acupuncture. You know it's the bomb. You are TCM rock stars. So I'm so, so happy. We did this and it worked. Woo! See you soon on any of the social media platform. Have a fantastic rest of your day wherever you are in the world. And if you're watching the replay, thank you for taking the time. Have a fantastic day and keep rocking it using TCM. Yay! Look at all the love. Thank you guys. Thank you. Thank you. Thank you. Awesome, Ingrid. Thank you. Beautiful. Thanks, Michelle. Thank you, Hank. Thank you, Rule. Thank you, Alex. Elise Angelina waiting for live on tongue and pulse diagnosis. Okay. Yes, Cal. Thank you, Griselda. Awesome, you guys. Thank you, guys. I love it. Virtual hug to you too, Renate. Shabia, thank you very much. Meline, thank you. Taz, thank you, baby. I really appreciate that from a colleague of mine who's a rock star as well. So I appreciate that from all of you. Rubina, thank you very much. Awesome, you guys. Carmela, you rock. Thank you, guys. Paul, yay! Anna, thank you. You guys rock. I never want to go. I want to stay with you all day. I'm sure you have better things to do. Bye, Ingrid. Thank you very much, Cal. Leon Chu, thank you, guys. Thank you for promoting my class to your student. Thank Leon. You're the best. And I was honored that you decided to do this with your class today. Thank you, Margarita. Valérie, merci beaucoup, madame. And thank you, guys. Look at this, Rafi. Thank you, Brian. Yay! Thanks, Melanie, Anna, Eric, Anan. Woohoo! Thank you, guys. Have a great day. Neleke. And I'll see you guys soon on the other side.